Yes. Hello, everyone. My name is Professor Simone Di Giovanni. I practice at Imperial College NHS Trust, and I'm a chair in restorative neurology. That is an excellent question, because functional neurological disorders are a group of disorders. More than a disorder, we call it neurological condition that leads to altered activity of the nervous system that ultimately is manifested with a number of symptoms that alter people's lives. These include pain, include sensory disturbances, problems with the motor function, problems with balance, alteration in the mood. So it is a very complex condition. Thank you. This is another excellent point. Functional neurological disorders can be very serious. The problem is that we don't know exactly what causes them, and this leads to a bit of confusion in this space. Some people might think that functional neurological disorders are not very serious because they're not a specific disorder. However, they can really impair people's lives very, very severely. And the diagnosis of functional neurological disorder is mainly clinical to this day. And it relies on the fact that we can exclude any other specific neurological condition. Yeah, thank you. So functional neurological disorders can affect people's life in a variable manner. Some people have their lives so disrupted that they cannot attend to any activity. They can lie in bed the whole day, or others can still go to work, for example, attend to their family activities, but these are very impaired, meaning that they can just do this much and they cannot fulfill whatever need at work or with friends and family, they're expected to fulfill. Therefore, again, it is a very personalized, if you will, disorder that can affect people's lives in a very different manner. However, invariably, it creates problems that impair the quality of life of each individual, and therefore it needs to be treated and it needs to be recognized. It is unclear what causes it. However, it is believed that alteration in the balance of neuronal activity and signals that connect the cells in our brain and that connect our brain and spinal cord with our organs are not working properly. They're not well coordinated. They are not in synergy as they used to be before the disorder came, to manifest itself. And therefore, the acknowledgement that this condition comes from altered balance of our nervous system or the activity in the nervous system is very important to design some potential treatments. There is not one strategy. There are a few measures that I found useful in my experience. Typically, I have 4 lines of treatment. One is try to help the patient with some medications that tend to improve the symptoms and allow the individuals to help themselves in a way to get to the next stage, which is to have a clear clinical improvement. The medications need to be associated with some typically physical kind of measures. They include, for example, yoga. They include physical activity such as walking, swimming, and being engaged as much as possible without exhausting your nervous system, however. The other important aspect is to lead an enriched life. And this means that individuals typically benefit from making an effort to have more social interactions with friends and family. Another final strategy that I often find useful is cognitive behavioral therapy. So these are the 4 lines that I typically suggest, lines of 4 approaches that I suggest for patients to undertake. But each one needs to be individualized. That's very important.